There is a new revolution in hair restoration for men and women. And here to tell us more is board-certified plastic surgeon, Dr. Andrew Wolin, MD. Thank you for being here today.
Oh, you're very welcome for inviting me.
So this is an interesting topic. We hear so much about male pattern baldness, but you were saying this actually affects women as well?
Yeah, most of the patients that I've been seeing, truthfully, are women who have had either global baldness on their entire head or have had pattern baldness in the middle of the head. It's such an amazing group of women. So it's not just a male thing, it's a female thing as well.
Wow. So tell me a little bit about the advancements in medicine that are helping to give hair restoration patients better options that are non-surgical.
Okay, well, a lot of the patients I see, I try to do a full evaluation, and the patients I see, a lot of them are really not candidates to do grafting, in other words, move hair from one area to the other, but they are candidates to use new technology. So what I do is I use platelet-rich plasma, and I take it from the blood from the patient, spin it down, and I inject that in the scalp to stimulate hair growth, to stimulate shaft thickness, to stimulate all the good things that make your hair grow. Now there's stem cells, amniotic-derived stem cell growth factors that are also, I use that as well for injection. So there's all these new things that didn't exist before to really improve what you've got. And I think that it works just great, but you do need to continue to do it to get permanent results.
And why do you think so many people have shied away from these types of procedures?
Well, because people have a misconception of really what has to be done. And plus, the old type of surgeries and procedures had to do with taking out either very large pieces of your scalp and making it look like you had doll's hair, or you took a big strip off the back of your head and then had to cut that up and put it in. People had a lot of bad information about it. What we do is completely different. It's all new, new technology.
Yeah, and you've got obviously an artistic eye because you've been doing, aesthetic surgery for years now. Tell me how you go about getting that really beautiful natural outcome.
Well, I've been involved in hair for over 20 years, but 20 years ago when I first learned it, it was just too much work. Now it's much easier to actually provide it. And the fact that I'm a plastic surgeon gives me not only a but a two-dimensional, impression of what really should be and shouldn't be. So I'm very hands-on with it, and I'm involved with figuring out the hairline, figuring out what will work best for the patient. It's just not providing a surgical service.
Yeah. Now tell me about some of the same-day procedures that you have, and do they require general anesthesia?
No. What I do in terms of, this is non-medical, medical what we were talking about, but the surgical procedures are done with a new technology called NeoGraft. And it's a little machine that runs almost like a dental drill. And what I do is I numb up the areas of the scalp that we can steal the hair from, and then we take those little grafts, the individual follicles, and then we plant them in areas that are needed. You do not need any general anesthetic. I do it with just an injection. It's very similar to going and having dentistry done where you have an implant put in. It's just not that big of a deal. And if people knew how easy it was to really do it, really the downtime is very minimal because you can't really even see where it was put, and it works very easily for everybody.
And let's look at some of the before and after pictures.
Sure, sure. These are typical. This is the typical women who come in and have a tremendous loss in the central apical portion of the top, and by doing she had multiple sessions done because she had so many areas that needed to be done, but you can see how fantastically well it really can fill in with a lot of the women. And this is pretty classic on men. They have a very fine forelock in the front, and the temple areas are kind of working their way back to the back of the middle of the top of the head, and you can see how we make a very nice kind of look to the hairline. We take the grafts and we put the grafts in specifically in singles and doubles and triples to get everything that we need to get.
Really nice results. You've got a special offer right now as well.
Absolutely. What we're doing now is, for a limited time, people who call who are interested in getting evaluated, there's no fee. So just call our number, 480-270-6765, and we'll get you in the door and we will see what you got cooking.
All right, Dr. Wolin, thank you so much.
Okay, you're very welcome.
And if you'd like more information on Dr. Wolin, you can visit ScottsdaleNeograph.com or call the number on your screen.